I stumbled upon this. Came to the dentist today to see if they can reshape these partials because I don't fit in my mouth. I can't eat. The thing says walk-ins welcome, so I go in because they won't fucking use the phone. I go in and I'm like, I really need these reshaped. I can't eat. I can't do nothing with them because they hurt too bad around my other teeth. They don't fucking fit. I have to wait a whole week and a half to come back. I had an appointment today, but since I got everything done on Friday, they canceled the appointment today, so I just figured I would show up at my appointment so they won't fucking answer the phone, and nobody will do anything, and I can't. The whole reason I cut my teeth pulled and replaced is so that I can start eating, and I'm so hungry, because I can eat less now. I'm so fucking hungry, and This is one of the most common things I see happen with patients getting solutions to problems, and because lack of communication and the doctor maybe moving too fast, the team not taking the time to really help the patient understand how these types of solutions work. A partial is what she's talking about here, and I want to show you. This is essentially what she's complaining about, or what's struggling so much with. You see, it basically is a removable device that comes in and out of the mouth, and this slips in the mouth, and then how it's secured by the patient is by going around the teeth. See these rings, they literally attach around the tooth. You can see how she's so sore. It's because essentially this large bridge is sitting there. As she bites down, it's pushing against her teeth, it's pushing against her gums, and it's not a device that it would ever be comfortable. I think it's actually probably harder to wear than even a bridge, or sorry, even a denture. And so a partial is what I call a slow extraction instrument, because literally, because this goes in the mouth and it's constantly rotating as you bite down, it's putting forces on these teeth that essentially is going to cause a tooth to be mobile and eventually have to be extracted. And so I never recommend a partial. Partial is the worst solution. If the goal, like for example, when she's talking here, the goal is to make her so she can be able to eat again, well, then they really messed this up, because at the end of the day, if the goal was to help her chew or eat, then she should have had a real fridge put in between teeth, or a bridge with implants, or something that is being fixated without movement, because that's why she's in pain, is because every time she bites down, even if it fits well, let's say it even fits well, it's still going to be tender and sore. But there's multiple adjustments that they made over the years, over the first few weeks and even the first few months. And so it's really tricky, and it's really hard for dentists to make these work.